invite up to the stage Thomas Goetz and Bob Kocher. I'm going to allow Thomas to moderate this session, but before I do, I was heavily influenced by both of these guys over the last several months. After reading the decision tree, the whole way I was thinking about how we can help health and wellness entrepreneurs was transformed. And then I had the privilege of getting to meet Thomas at the HHS event on June 9th. And Bob and I met, again, in the White House. And Bob is, one of these people, I think, he just moved out to Silicon Valley a month ago.
Yep, I just got my jeans.
He just got his jeans. And
I was told I had to stop wearing suits and ties. Thanks, Brian.
And so Bob is kind of an interesting fellow in the sense to this sector because he's from Washington. He obviously helped shape the meaningful use and a lot of the healthcare reform. I think the good stuff, right? But he is a treasure trove of insight into the good and the bad that's coming from healthcare reform. And so when I met both Thomas and Bob at HHS, but really speaking with Bob more specifically, and he was telling me all the things he's experiencing as a venture capitalist, it made so much sense that bringing these two geniuses together to discuss the topic of bridging the gap between health and wellness investors and health and wellness entrepreneurs. Thomas.
All right, cool. Thank you, Steve. And so just, I know we're long, so I'm going to ask this publicly. I can't whisper in your ear. Do we want to do a hard stop at 7?
What time is it?
It's 5:45. I don't want to.
I think we're going to do a lot of Q&A. So
right, and I'm sorry that you guys can't quite see us all, but all right. So we'll talk for as long as we can talk, and then we'll break for questions and try to wrap up around 7, just so you guys know the end is in sight. So I'm one of those media guys that Ryan Howard was talking about that he was trying to beguile and I would almost dare say trick into covering the companies, and it's an interesting perspective that I've had over the past few years as an observer, as somebody who was deeply invested in technology and the power of technology to change things. One of the things that we do at Wired, basically the template for Wired Magazine is just to look at how technology routes around a problem, right? It sees there's a problem in the world, technology routes around it, and there is solution, there is improvement. We believe in progress. When you get to something like healthcare, it's a hell of a problem, right? So it's a big morass. And for me personally, it was 5 or 6 years ago when I was taking a somewhat sabbatical at Berkeley and getting my master's in public health. I had the inklings that you put this world of technology together with the world of healthcare, and you could create some interesting things. But even at that time, 5 or 6 years ago, there was very little going on, almost nothing going on. And so it was really, for me, something of a leap of faith to try to start feeling this area out. And what now is a bona fide industry, right? A whole field. So I'm excited to be able to kind of have the dialogue with you guys, in part because you have both been on the broad arc of this thing. I mean, we've talked about what Bob's credentials and whatnot. I think I can put it rather neatly in saying that without Bob, there would be no big fucking deal, right? That's the words of Joe Biden when he whispered into Obama's ear at the signing of the healthcare law. Bob really paved the way for making that happen. And Steve, your background going all the way back to '94, I think, was your first startup. So you've gone on the highs and lows of technology. You've seen how the successes and failures happen. So what I thought we could talk about was kind of the mechanics of startups, the mechanics of healthcare startups in particular, but also get some sense of the landscape. Why healthcare is an opportunity now. And in fact, why don't we just start there? Why is it, in fact? I mean, we're all looking at through this prism of healthcare, but is trying to step back outside the world of healthcare, is healthcare an opportunity now, as in terms of the Silicon Valley landscape?
It is exactly the time to be attacking the healthcare system because the current system is a dinosaur stumbling into the tar pit. And what's pushing it in is 3 things. One is demographics and rising demand. So as a country without healthcare reform, we're getting older and all going on Medicare. We're adding 34 million people, and the current system as configured can't accept that. So it simply has to change. The second thing is we can't afford it. The current system with the current prices are impossible for either the public sector or the private sector to keep paying. And so there will be cheaper things that emerge. And the third is we're not very good. The quality of care and the reliability is lacking in virtually every aspect of the health system. And many of the companies we've heard today attack parts of it, but in aggregate, the system itself doesn't actually work well. And so those three things are pushing it into the tar pit of evolution. And we're going to have hopefully punctuated evolution and real change soon. Not from fixing the current one, but actually from building a better one around it. And many of the companies today are bricks in that new system. And also, those of you who are figuring out how to work around it are wise, because the current system is actually not going to be the one that 5 to 7 years from now is the dynamic one that you're going to want to be part of.
Do you concur?
Oh my God, yeah. I mean, you know, Todd Park, if anybody who hasn't seen Todd Park, I mean, I think everybody's probably seen Todd Park do his "There's never been a better time to be a health and wellness entrepreneur" speech. Couldn't be more true, because while everything is broken, you can almost see the future of the healthcare space just going back to 1994 and see what happened in every other sector. It hasn't happened here yet. And so if you're looking at everything that's wrong with the system, there's a lot of people who've given up, but there is such a optimism among entrepreneurs today, and even investors. And we were talking about this. I was talking about this with Rebecca earlier, and Bob last week, as well as Sue Siegel from More Davidow. There's something brewing here, and there's something brewing because I think everybody sees that just applying some of the stuff that's happened in other sectors to this sector, we can fix this broken experience that I think you can experience as simply as going to a doctor or trying to find a doctor, or trying to Google a symptom, or trying to figure out how to navigate all the documents you get from your insurance company. And so it just seems so clear that why we put up with this, and we get excited about a new Groupon clone, and we get excited about a new Facebook feature, and we, if anybody watched the TechCrunch Disrupt, not the healthcare pieces, but the other ones, you're looking saying, people are incredibly excited about, like we saw today, a backflip got everybody laughing and excited, and there's startups all over other sectors getting funded with gobs of money, and people are attacking problems which aren't real. And so when you see someone doing a backflip for a healthcare company, you get excited because you realize some of that energy is finally here. James Currier and others coming to this sector with experience from other sectors and truly changing something that is so fundamentally broken.
Well, I'd say it's simpler. It doesn't have to suck anymore.
Yeah.
We actually have the technology to make healthcare fun, healthcare engaging, and healthcare convenient. And the current health system doesn't do any of those. And we're actually all consumers of healthcare and increasingly spending more of our money for it. And thank God there'll be actually people who will provide an experience and a product and reliability that doesn't suck. And that's why we do backflips, is that we don't have to actually read magazines from 4 years ago in the waiting room while the doctors wait, hopefully in the future.
So I believe that, but I just want to.
But you like it.
Well, I want to test this notion because the people have thought this before. Jim Clark in '95 thought healthcare was prime pickings, and he created Healthion, and it didn't work. And more recently, 5 6 years ago, Steve Case thought Revolution Health thought it was time for a revolution in health, and it wasn't quite there yet. And if you actually look at the rhetoric, the pitches, it was the same. They were preaching the same prayer, but it didn't work. So what's changed between then, the last 5 years even, and now? The
big bets that used to need to happen in order to make some of these changes happen. Most of the companies you saw here today, but for a few, could be funded to go through a customer development cycle for $1 million. When I started Webstakes, we spent millions of dollars on servers and And I remember developers sitting on boxes of Silicon Graphics machines, which I don't think that company exists anymore. The cost structure of building companies, to innovate in healthcare, you used to have to be a scientist or a PhD and have millions upon millions of dollars invested. And today we saw a $99 software development kit downloaded from Apple can change the tools that we have. And so I think the barriers have come down. It doesn't cost what it cost Steve Case, $100 million plus to launch an internet healthcare or online healthcare company today. The nice thing is we're not seeing media, advertising-supported media companies up here pitching health information sites. We're seeing productivity enhancers. We're seeing ways for doctors to make more money. We're seeing ways for patients to be happier. And so I think the thing that's fundamentally different is it costs a lot less. There's a lot of people that have been inspired by the iPad and what it can do and how beautiful it is to use. And the way James took the iPad and took a very simple application and created a way for doctors to draw, that's not $100 million invested into a 15-company roll-up it's called Revolution. It's, let's try something and try to make it work. And I think the willingness of investors to put some money in is going to be an important piece. And that's why, quite frankly, we said we want to do 1,000 companies because we don't know which ones are going to work, and we're not making big investments. We want to work with venture firms. But we will make $25,000 small investments along with other investors because let's make a lot of bets. Let's make 1,000 bets because no one knows what's going to work, and it doesn't cost a lot to figure out and get some customer traction like it used to cost in the old days.
I think there's two other big differences, and that is first, almost all the profits in the health system today come from large employers with large insurance bases paying high prices to subsidize everything else. And they can't afford the price increases, so they're willing to experiment with either new companies or new ways of engaging their employees to consume differently. And the second thing is the rise of the individual market. The individual market almost always is characterized by high cost sharing and a need to find more productive, lower cost, more convenient ways to get care. And both of those markets have changed considerably from 1994, which makes them a lot more receptive to both startup companies and new ideas, but also amenable now because they can't afford the current to try new things, which is why many of the companies that were up here today who are going to actually sell into big employers have a shot because the employers are going to take those meetings that they wouldn't have taken before.
So I want to ask about the cost thing because you were talking about how cheap just the startup costs have decreased exponentially, and that gets at this amazing op-ed that Mark Andreessen wrote for the Wall Street Journal 6 weeks ago on the key phrase was software is eating the world, right? And it was awesome, and everybody should read it even though it only had one sentence that pertained to healthcare. It identified healthcare and education as the next ones. So if somebody like Andreessen would concur with you. But so it was this great exposition about how this has happened, right? How software comes along and it creates efficiencies, it creates scale, and it just changes industries, fundamentally transforms industries. It's the same ideas of disruption that we've been talking about for a long time, but it was just really well put. The one thing, though, that he didn't mention, and this gets at the other side of cost, is how when software is eating the world, when it goes into an industry and eats it, it often has the result of turning dollars into pennies, right? So think about the iPad. There are EKG apps now that are basically turning what were tens or $100,000 machines into apps. That is totally transforming industries, right? It is destroying businesses as well as creating new ones, and it's decreasing costs in many ways all over the place. That could be great in terms of the healthcare, the overall cost benefits, and I'd like to talk about that. But I'm curious about if that makes it difficult to start up money or start up companies when the effect of those startups is going to be turning dollars into pennies.
Well, I mean, from my standpoint, I'd love to hear Bob's. I mean, I think that you don't need the same necessarily returns when you have a company that can be started and built for relative to what it used to cost to transform healthcare. A company, for it to hit, they don't all need to be $10 billion hits. One of the things that I was struck by the 125 applications was like, I want them all to figure out how to navigate or pivot and become something. But even if they don't, there's going to be some successes that make some angel investors some money and that make people some money. And I think the venture world might need to think about how they can bridge this gap between all the big hits, the billion-dollar hits that they're looking for, and all these other opportunities, which I think are going to be incremental improvements in changing healthcare. I don't think there's just going to be this fundamental shift to it's either a big company or it's dead. I can tell you right now, you don't want to pat an entrepreneur on the back just because their idea is not a billion-dollar hit in healthcare, because you want to figure out how you can help them. And I think one of the interesting things that can come out of this next kind of era of entrepreneurship and health and wellness is going to be we all want to help each other, even if it's not about investing and making a billion-dollar hit. You get somebody like Bob to help you, even though he's not going to invest Venrock money. He can be transformative in helping you bring your product to market or bring it into some other company that can be transformed. And so I just think because the dollars are smaller, again, the stakes are high in healthcare. If you can change my mother's experience with dealing with her mother going through Alzheimer's disease from a caregiving perspective, or like Shira Bell's company can make my mom who goes in for back surgery have a better experience, there's something more meaningful than just making money when we're talking about the transformation of healthcare. And so it better not just become dollars or pennies and no one's interested because there's no billion-dollar hits out there. Although I think that there's about to be some large-scale hits that will bring a lot more visibility to the space and get the big investors a lot more excited.
There's going to be a lot of $10 billion hits too, though.
Yeah.
And it'd be fine if only half of them are that from our perspective, I'm sure. I would retire. There's $900 billion a year of wasted money in our health system. That's 30% of the cost. It was $750 billion 2 years ago. This waste is growing fast. And so there's a lot of money that needs to come out. And entrepreneurs who can invent cheaper EKG machines are going to be able to take the $600 it costs today to get an EKG and sell it for $60. And there's going to be a big delta there. And if they get clever on pricing, they'll be able to figure out how to do it in a capitated model or in a population health model where they can capture a big amount of the savings. But there's so much money to be made taking money out of the system that I think the cheaper disruptive EKG type technologies, to take that example, are actually going to get paid a lot more than pennies and make a lot more than actually make billions of dollars. And so the size of these markets are astronomical. Healthcare is just the waste is $900 billion. And the waste, when you look at where that is, half of that's actually in outpatient visits because there's too many tests, too many visits, too many referrals, not enough self-care, not enough evidence. And so there's a huge chance to actually get productivity in that part. And healthcare is striking because it's the only part of the economy, save education, that in the last 50 years has seen no gains in productivity. So there's been all the growth in healthcare has been through price and cost, not through productivity. And that's different from the whole rest of the U.S. economy. And so there's a huge chance actually by having things cost pennies to make them worth billions. And so I'm inspired by that idea, and I think many people are actually making companies that are based upon that.
So so that $900 billion of waste is a huge opportunity. Is that the kind of sexy part of health and wellness? I mean, is that the behavioral kind of startups? The companies that we saw today, for instance, were very exciting and all kind of cool. Taking waste out of the system doesn't necessarily sound cool.
Waste is avoiding complications. So, not having readmissions to hospitals, which we saw today, is a good example of that. Not having medication errors is a good example of that. Not having the second CAT scan for the same symptom for a different doctor is a good example of that. Not going to the ER when you can go to an urgent care or be treated at home is a good example. Being able to see a doctor on a phone who can tell you that this rash is not gangrene is a good idea. So there's a multitude of ways that taking waste out actually is emblematic of what we saw today, and makes the patient better sooner, is more convenient, and is a lot cheaper, and it gets you out of a dangerous and horrible environment, which might be a hospital ER.
So going to some scenario where there's well, actually, let me ask, do you know off the top of your head how that proportion of waste might be comparative to other industries? I mean, some other industry has...
Well, there is no more inefficient industry in America than healthcare. And so it's actually the only one that showed no productivity. So it is unique in America.
So you bring that, but so you say you take that waste down to a mean of the average industrial waste in any given industry.
So
there's still like $2 billion or almost $2 billion of market there, right?
Oh yeah.
Let's just for a second go into the kind of fine points of your strategy, because I think the idea of you looking for companies that might kind of chip away at this waste is an intriguing lens. But when we talked earlier, you had this really nice checklist of four things that companies should do before they even get to you, or that you kind of your own filter. And I think that's a very useful one.
Sure. So some thoughts for entrepreneurs as you're kind of thinking about the health system. You guys are fast at Startup. Startup Health is like can take anything you say and make it into a product faster than anybody I've ever seen. So there's a handful of things that I would encourage you to be thinking hard about. And the first one is, what is exceptional and special and competitively different about what you're doing and defensible. We heard that a few times today, what makes it defensible. But many people I talk to don't know enough about what makes their approach uniquely different and more effective than others, and struggle with but how couldn't this be copied? And that's a big question I think any investor is going to have. Is you don't want to put your heart, soul, and love into nurturing something along and then have somebody tomorrow say it's a great idea and copy you and beat you. The second one's the hardest question I think in healthcare, which is how much value do you create? So how much waste might you get out, but how much value do you create? When is it created? Who captures it? And how? And that lining up those things to know how much value, when, who, and in what form is critical to having a big, successful, and growing healthcare business. Most people who make mistakes of creating a lot of value, but it's captured by somebody who's not paying for the product, and so people who pay aren't going to pay much if the value accrues to somebody else. In many healthcare enterprises, the value takes a long time to accrue. And so how do you monetize that? Because people just want to pay for things that you can measure usually within a year, if not a year, 2 or 3, but not 10. And knowing in what way. Is it less absenteeism at work or less turnover? Is it less healthcare costs? Is it what kind of value are you creating? Because that really belies how to design the next thing, which is the pricing model. Healthcare pricing is frustrating because consumers tend not to want to pay anything. They think it's already included in the massive amount you're already paying for your health insurance and in taxes. Doctors and hospitals all claim they're going out of business, so they don't want to pay for anything. Health plans decry that they're the lowest margin part of the health system, and they can't pay because they can't raise premiums. Pharma and biotech had been the place to go get them to pay, but they're actually really struggling. They're dinosaurs that have also stumbled, and so their margins are going down, their pipelines are drying up. They don't have the marketing budgets and cash that they need to plow into stuff. And so figuring out how to price this and how to make sure you're pricing for value is a really tricky part of this. And the last thing is, how do you scale? So I've seen myriads of amazing ideas that work really well in like kind of the laboratory setting or with like one customer. And it's often because the team is absolutely fantastic. And so it's the magic of the 3 or 4 people that are making it work in that context. How do you do it 3,000 more times? And how do you get the quality of people on the replication to be anything close to the people in the actual demonstration? And how do you do it cost effectively? Most startups spend $1 gajillion, at least in effort, to make it work the first time, but then they've customized it and made it so special that actually the next 75 times they do it, it doesn't really work well. So how do you do this scaling, and how do you reach the market efficiently? Because healthcare, despite the trend towards consolidation, both vertically and horizontally, is massively fragmented and will be for the next decade. So most healthcare is for better or for worse, probably for worse for now, delivered by small, unsophisticated businesses that are hard to reach. Not in cities that you want to go to. And so how do you actually reach them efficiently and have them get the same value that you capture when you're doing it in your kind of showcase sites? And those are the 4 things that I usually struggle with as I'm listening to people with ideas. And I think entrepreneurs struggle with in healthcare uniquely because these questions are not as straightforward as they are in most other sectors.
So I actually want to take, the interesting thing about the creation of what you just outlined, and actually a filter, and we're going to actually do a boot camp session, a 1-hour session with you helping entrepreneurs in mass, so not individually, work through this exercise. But think about how fundamentally different a meeting with you will now be when you will not take a meeting until they actually have taken the filter and at least have thought through. They might not be the right answers, but they're going to have thought through some of these issues. And I think as an entrepreneur...
Or they can walk in with a latte and I'm happy. So,
right. But as an entrepreneur, there's a lot of guesswork about walking into meet with Rebecca Lynn at Morgan Thaler or Sue Siegel.
So Rebecca, that's scary.
That's but distilling down their wisdom about the things they care about and trying to, again, take some of the guesswork out, not to make it a home run for the entrepreneur walking in or to make it a less interesting meeting to have to scare the hell out of the entrepreneur to have them run away, but to truly think about how your discussion can be shaped. And so I think this filter, especially what you just outlined, for me, none of them individually are unique, except that together they are what's important to you. And I think that idea for an entrepreneur is transformational. And if you go firm by firm and investor by investor and even organization by organization, what are the things that are important to GE? What do they really care about? What's going to make them want to invest in your company? Or you go over to Pfizer, or you go over to a hospital system, or you go over to Aetna, and how do you distill down what's important to those organizations or people so that the entrepreneurs have the tools and the investors have the method to have a more meaningful conversation? And again, it's important from a healthcare perspective to me just to eliminate some of the guesswork.
Yeah, and just to put this in context, these are pitfalls that many people make. But I think the main thing that as an investor that you're thinking about is that you're thinking you're going to make just a handful of investments in a year. And you're trying to make investments that not only answer these questions well, but if they succeed, both you and them would be really proud of what you've accomplished. And so there's a bigger question of, when this succeeds, is it worth it? Have you changed healthcare in a way that's going to be lasting and meaningful and going to help people? Is it ambitious enough? Is it worth doing from those perspectives too? Now, once you've said yes to those, then you have to have good answers to each of these, or the business is not going to go well. And so that's, I think the most important thing for any entrepreneur is to come in with the passion that draws you to start the business and the answer to how this actually changes the health system. And that's what's going to be the key thing. And then this is like the homework, the math assignment that you have to go through to make sure that it's actually going to be as efficient as it could be to be successful.
So I know you've only been at Venrock for a few months, so I can't.
I can disclaim this by saying it might be wrong.
So in your experience, how well do people just intuitively have these? How much has this been internalized among entrepreneurs?
It's usually a disaster.
Really?
Yeah. Honestly, the passion. We heard it from Ryan Howard's awesome kind of testimonials about what it's like. Most people are so deep in the problem they're solving and so expert on how their thing works that they haven't actually worked all the way through but how much value is created, who gets it, why. Why would I buy that if I'm a customer? The price is higher than the value. How did that? They haven't usually gotten that part right. They usually have awesome engineering and beautiful thinking on the idea, but the actual how it works in the marketplace is usually not correct.
So even if they've got the wrong answers, to have some kind of answer to these things is a step in the right direction.
Yeah, blank stare is not good.
And so you actually, I'm fascinated in this process. So you will go through and you will ask them, and they will not have an answer.
And we'll answer them on the whiteboard. We'll try to figure it out. And but if I'm doing back the envelope math faster than they are, it's not a great sign for the chances.
All right, point taken. So one thing you touched on, and I think it comes out of number 4, is this idea of what is the target opportunity and scale, and where does this company kind of get its value long term? And I'm curious about that, and going back to this idea of opportunity for disruptions. How important is it, do you think, that given the $2 trillion plus healthcare industry of opportunity, how important is it that startups and entrepreneurs be trying to change that system to find their their value be within the internal kind of structures that already exist in healthcare, or how important is it that they actually be shaking things up and changing the way the healthcare system works right now? Not be playing by the rules or be making new rules?
Well, I'm way more interested in people who are going to shake up the system. I think that it's unassailable that approaches that help patients get better outcomes, that are more affordable, and better experience are going to subsume what currently exists, and people that are playing in those areas and in areas that make markets, that make more rational and functional markets of healthcare, are far more interesting to invest in than stuff that incrementally improves the current system.
So, Steve, let me ask from your point of view then, is that, since that is by and large what organized wisdom is about, is
Startup
that...
Health.
Sorry?
Startup Health?
Yeah, but I was asking about your
I'm
company.
sorry, yeah.
As an entrepreneur yourself, do you think that that's a harder sell in the marketplace when you're trying to change the system? I mean, when you're having to go to insurers and hospitals and doctors and explain how healthcare, how you're going to not exactly be playing by the current rules, but want to be changing things?
I think the one thing that I've learned as a health and wellness entrepreneur that I didn't learn as an entrepreneur prior was the patience that I think you need to have to play in this space. And that there's a rule that I learned, a lesson that I learned from one of my mentors many years ago called the rule of 21. And it was that there's 20 other things that are on the mind of the person that you're speaking to, or 20 other challenges or 20 other problems that they're thinking about or dealing with that are more important to you. And the lesson behind it is funny because I was speaking at Stanford yesterday talking about this with like 21-year-old kids. And this idea of having the ability to be mature enough to say, you might not understand what I'm doing right now, but you will. So I'll keep coming back, and you keep telling me what you don't like or what I have to do, and I'm gonna be here for the long haul. And I think that whether it's a VC telling you your idea is not ready or big enough or going to be that transformation, or it's a doctor saying, I don't see how it's going to make my office more productive, or it's a patient saying, this is not making my experience easier, you kind of, in this space, because of what's the underlying drive for most of the entrepreneurs I find in this space is that we all just want to make sure it happens, and then we want to see our solution help the situation. And so to me, it's not, I go back to the rule of 21. I'm okay with the fact that there's 20 other companies that he might be looking at that are more interesting, or 20 other things, or he might have 20 other personal things, and I'm like the last thing he's thinking about, but I'm going to keep coming back and learning from that experience. And so to me, what customers say, or what VCs say, or what angel investors say, to me, I always use those as learning experiences. And in healthcare, plan on a decade of learning experiences with your company. I say a decade. Like, these are companies that Phreesia started 7 years ago. In any other sector could have IPO'd probably. ZocDoc today raised another $25 million on top of the 50 they raised 3 weeks ago. I'm scratching my head. Great, wonderful, but those guys have been working on it for a while, and it's going to take a lot longer, especially because the investors have to see a return on the $700 million valuation they probably got on that, or they did get on that. And so to me, across the board, the word's patience. To me, it's it might not, my product might be not ready now. Organized wisdom, in this point in time in my Web Stakes life, we had IPO'd our company already and had a tremendously different experience building the business. And it's not just because of the business; it's the sector you're in. Just has a completely different timeline.
So just two bits of color on Steve's comment. So full disclosure, I can only remember 7 things, which is a phone number. So it's not 21. So you went to better schools.
The rule of 8 for you?
Yeah, maybe 8. I don't know. I'm lucky. My wife says I can't actually remember more than 1. The second thing I'd say is that patience is true, but we can be a bit more impatient now in healthcare because the confluence of healthcare reform and all the regulatory changes, the HITECH Act and meaningful use, which is also going to evolve into stages 2 and 3, the Health Data Initiative, which is a treasure trove of data, a tsunami really coming, that's going to fertilize many of your companies. Coupled with the economic calamity, which is the debt crisis and employers who can't pay for healthcare anymore, is making a more receptive market than we've ever had at least in our entrepreneurial lifetimes, to create products and innovate in healthcare. So, yes, it takes a long time to grow, nurture, nucleate, grow, nurture, and make great companies, but the market will be a lot more permissive now than it may have been before. And so I think it might not be consumer tech investing that has a rapid cycle, but it's getting more rapid, I think, particularly in most of the areas that we saw today, which are the non-regulated aspects of healthcare. So most of the things we saw today don't require FDA approval, don't require complicated reimbursement decisions by CMS, and so that allows them to actually have a faster cycle.
So let me just follow up on that, because there's a potentially strong possibility that in 2012 there's a different administration, and all these people who've put all this data stuff in the data liberation and all that are not going to be in Washington anymore. Does the climate turn sour for entrepreneurship based on those initiatives, or is this stuff that is going to be established enough that it will remain fertile?
So even in a Bachmann administration, I'm not going to actually make the comment that came to mind, since this is actually being videotaped. In whomever may be our next president, actually, healthcare reform, first of all, is highly unlikely to go away. An executive order cannot stop a congressional law. There's a constitution that says that the executive branch cannot actually make laws. And so whichever president we have, we'll look at the constitution and realize that an executive order cannot stop healthcare reform. It would have to get overturned by 60 votes in the Senate. If you go to 538.com or pick your favorite in-trade website to go to, even if Republicans take the Senate and the House and the White House, they won't get 60 in the Senate. The minority party in the Senate has a ton of power, so it's very hard to imagine 60 votes in the Senate voting to repeal healthcare reform. And so the law is very likely to stay in place regardless. The second thing that's very likely true is that in every permutation of Republican budgets that have been put forward, they keep all of the cuts. So most of the changes actually stay in the Ryan budget that was passed and in the different healthcare plans that Republican candidates have put forward. And so likely the macro effects around forcing productivity and driving cost effectiveness is going to stay, if not intensify, with deficit reduction. Thirdly, the Health Data Initiative, many of the data sets are actually in statute that they have to go out. So in 2013, the Physician Compare data set has to be made available to the public for free with no intellectual property constraints. 2014, all the data on health plans and exchanges become available, again, under statute. The CMS hospital compare data, nursing home compare data is already out, and it now is in statute that it has to stay out. And so there's a lot of hoops that would make it hard to stop the tsunami of data. And then finally, the big effect here, which is that large employers and the commercially insured market can't accept the increases they've been getting, is going to drive this regardless, because all the profits of the hospitals, of the doctors, is actually from those commercially insured patients. That demand is changing, and there will either be dropping coverage and going to an individual market. There'll be employers going to define contribution, but fundamentally, the payment system is changing. And that's not going to be changed by the political climate in 2012. And so I think that the tailwind that you have as you're designing companies is absolutely a consistent tailwind regardless of the politics in DC. If anything, more deficit reduction and more pressure on the current health system will accelerate its change and force you to market sooner, which might be a good thing. Although I do hope that the president's reelected. I pray to God.
So I have just to change the topic a little bit, I wanted to ask about this notion that's all kind of a buzz in the Valley these days is the pivot, how important it is to do the pivot. For a startup company to be agile and all these kind of buzzwords you hear. Is that harder in healthcare? I mean, is it harder to start with an idea and then kind of adjust it on the fly, given perhaps the regulatory environment and whatnot? And I think you both could answer that question.
You want to go first?
You've had to pivot, so.
A couple times actually, mini and a major. I mean, I think. Is it harder in healthcare? I think the customer development cycle is longer. So where you might go out and test very quickly, if you're doing like coupon check-ins in a restaurant, or you're, launching an iPad app to see if there's traction, the customer development cycle in healthcare is longer. So it's going to take a lot longer to get the feedback that gives you the data that makes it a better or more informed decision to make that pivot if it's relevant. And the funny thing is, companies have always pivoted. It's just now kind of cool and sexy and accepted to use customer feedback to change your direction. And a lot of it goes back to the thing that's different about business today, which is you can iterate a lot faster, a lot cheaper. Not only is it a lot less costly, but the tools are available. You talk about the data, what Todd Park and Aman and HHS has done over the last 18 months, liberating data. Like, you could take some of that data, play with it. It might not be the right data set. You might want to add something else. You might throw out what you've been working on for the last 6 months because it wasn't, well, it didn't cost as much. The idea of listening to the customer and iterating is still important and makes it as important, if not more important, to do in healthcare, because you don't want to make a bet and it be just the only tunnel vision that you are using to make that decision if you're not going to use that customer feedback. So to me, it's going to be, again, a little bit longer to get that customer feedback, but as important than ever to use that feedback to make the right decisions on what the company should do next, whether it's for shareholder value or, in this case, the outcome of who gets the value, which is the patient or the doctor or the hospital system. So I think the pivot is alive and well and welcome here. It'll take a little bit longer, but should always be embraced as part of the customer development cycle.
Yeah, I think every company naturally has to pivot many times. And I think about when I was talking to Todd Park about moving to Silicon Valley and trying to work earlier stage companies, he told me the hilarious story of Athena Health, which was somehow they got venture capitalists like Venrock to invest in it when it was going to be a OB-GYN practice management administrator company in San Diego for a practice that loses a lot of money seeing Medicaid patients and had no ability to pay. And Todd somehow, and Jonathan Bush, which would have been hilarious to see in an OB-GYN office, went down and tried to run the office. And they totally sucked at it. They lost plenty of money. They were going definitely out of business. I don't know what their pictures would be of what they had to give up that they had, but it clearly was a lot of things, and God knows what they did. But they eventually stumbled upon oh my God, they get a lot of faxes. We can probably figure out some way to organize this faxing and make it make sense and not lose so much money on the billing. And that was the genesis of Athena Health, which was at first just people scanning faxes in India and figuring out which ones you had to respond to. And became a pretty good revenue cycle company and eventually a big and successful company. But Todd describes, in his way, 11 big pivots they made, which were fundamentally different businesses. And then finally they kind of got to one that they could refine over time. And I'm on the board now of a company, Castlight, which Todd interestingly co-founded as well. And that's a company that's been through many, many pivots as well to help it become a company that now has a lot of traction. And there's no question that your first data has to be imaginary, have enough, capture the imagination enough to get the investors excited and answer these questions in a way that's plausible. And then you both kind of know, yeah, but it's wrong. And then you're going to have to fix it many, many times going forward. And it's having the agility and humility to throw out your beloved first idea to make it a better idea. That's really essential to success. And I think that's the sign of a good business is actually a willingness to make that pivot and to find ways to test it more quickly. And that's where some of these ideas that leverage cloud computing and big user communities get pretty exciting because you can test things more quickly than the old days of having to go to a hospital to give you feedback with the doctors who wouldn't meet with you. I mean, it's getting easier.
What's interesting about what's going on in other sectors, this whole idea of lean startup, and it really, at its most core, it's not just, everyone thinks it's like running a small company or cheap company. It's actually this idea that you're embracing customer development and validation early and often. And I think that what healthcare can benefit from is some of the other sectors that have been doing this for several years and how to attack building their business a little bit differently and accepting this idea that as quickly as you can get out and test with your customer your idea, the better off you'll be. You don't need to go, most times now, even in a lot of the companies today, you don't need to go out and do a full implementation to get customer feedback. And so in one of these 50 office hours that we ran, or 60 office hours that we ran in August and September, we kept having these conversations over and over again, listening to entrepreneurs not talk about their primary customer because they listed 20 different types of customers they could have, because healthcare's got like, it's like a, you know, who's the customer? Oh, the patient. Oh, the doctor. Oh, because everybody's a customer. Oh, who pays for it? Oh, is that the customer? No, or is it? And so because it's so confusing, if you can lock down your primary customer right away and say, who do I want to be? The question's going to be, so what are their biggest challenges? What are their biggest opportunities? And who are 5 that you can talk to as quickly as possible? You might be one, and that's obviously a good sign, right? If you're actually the customer, you know the pain point personally. But if you can identify early who your customer is, get feedback, the validation process by the time it gets to a VC or gets to even an angel investor can have some even just data points that can help in the removal of some of the pivots down the road, because they made sure that they began the company or started with the foundation of understanding the customer's pain points and if their solution is going to create value or not. And if it does create value, what's it going to be worth? And it goes back to your pricing of number 3, like what's your logic behind that? So again, it's just that I think it's an important piece, but just something that should be embraced.
Excuse me. So I wanted to turn to the questions, get you guys involved. Do you have any off the bat? There's one right up here, sir.
Yeah, one of the discussions we have a meetup here for personal health technology. You actually spoke there. And one of the things that we're talking about is the benefit that a lot of technology companies have now, that they can purchase and use cloud computing in other industries, and you don't have the data issues. What are your thoughts in terms of sort of startup infrastructure? I mean, that's a factor that we still haven't really been able to benefit from in this sector. And what are your thoughts about how we might be able to incubate faster by having trusted places to build, virtual machines fast and interconnect them and go? Because that's been one of our barriers to getting going fast, honestly. We had to build the whole thing.
You should repeat the question too.
I can't.
Well, one thing that happens now is you go down the valley and somebody says to you, I need to raise money. The first thing you can't buy is servers, machines.
Yeah, so how do you get access?
You go to Amazon and you put up a couple of virtual machines and you start to ramp and you wait for it to grow, and maybe later on you think about changing your your investment structure to, now you own your stuff or whatever.
Mm-hmm.
You can't really do that if you're holding healthcare people's data. You can't just put it on Amazon because you've got a problem.
So fortunately, there are some, healthcare HIPAA compliant private clouds that are emerging that hopefully will help with some of the computing capacity problems. And but I think you're right. I think getting access to, like in every other sector, to ubiquitous computing power for pennies needs to happen in healthcare. There are people that will do that, and there are ways actually, even on the large enterprise ones like an Amazon and others, to meet HIPAA's requirements if you have patient data. I would also say most healthcare data does not have HIPAA requirements on it. Almost all the data that HHS has made available as part of the Health Data Initiative, virtually all of that and all the stuff that you can download for free right now without any intellectual property constraint, does not have any HIPAA requirements. And so you might need computing power and access to the cloud, but that data could be put on any cloud. And I think we're going to soon see a lot more large, healthcare-oriented either aspects of, the Amazon-type cloud or other people that will do it.
Can I take one of your microphones and go out into the audience with this, just so we can make sure that we get this on for the people who are watching on live stream?
So let's go to this gentleman right there, and then I'll go up here.
Okay.
I just wanted to first thank you guys. This has been invaluable. I'm an oncologist and an entrepreneur, and I work obviously with patients who are sometimes in the very last phase of their life. And Bob, what you said about fun and what you said about engaging, I truly believe that there's an opportunity for doctors to reconnect with patients and make it fun, bring back the heart of why we became doctors in the first place. And I really think that this is leverageable, and I really think that there's a space here. I just wanted your thoughts on that. I know cancer isn't fun, but I think that the reconnection between doctor-patient, or all healthcare providers, patient and pharma, is a huge undertaking, and I just wanted your initial thoughts on doctors and patients working together in this space rather than us versus them.
So I actually left Dana-Farber Cancer Institute, where I was becoming an oncologist, to go into healthcare policy, and my background's in caring for bone marrow transplant patients. And one of the most unfun medical experiences that I've ever seen is both cancer treatment and then the bone marrow biopsy aspect of cancer care. And the patients that did well, and there's an interesting patient who wrote a book about how to view healthcare as funny. And they went through and they wrote this fascinating book about how hilarious it is to watch the incredibly ineffectual, badly designed healthcare systems struggle to help them, which tells you about what an extraordinary patient this is. But I think there's a huge opportunity because every doctor I talk to, the conversations have one or two flavors. One is, how can I get a job not being a doctor? And how do I get into policy or consulting or a startup or a government? Because they're unhappy. And the second one, if they don't want to quit medicine, is medicine's gotten to be so painful because the amount of time I spend having to see more patients a day, do more coding, switching to the new coding, my EMR actually isn't making me more productive. It's awfully painful. My nurses are quitting. I can't staff them. I need to have that nurse call thing because they're paying temp labor a lot. It's no fun at all. And the patients are pissed off because the doctor's 45 minutes late. They can't tell them they're going to be late. And so the whole thing is just frictional. And so I do think there's a huge opportunity and a wealth of customers who want to make the interaction not painful and also make it more honest with each other about what to expect. So medicine does not cure most things. It helps you manage better with them. And helping patients understand that, what are the goals here and what are we trying to achieve and how do you make it actually mutually fun? Because doctors who are having fun with the patients are a lot better doctors. You'll talk more to them. You'll ask more questions. You'll be more excited when they succeed. And patients who are having fun are going to be infinitely more likely to take the pills as opposed to manage the complications with you. And so I think there's a big opportunity to bring creativity to this problem. I can't imagine that a more fun and engaging approach to care isn't also cheaper and isn't one that actually wouldn't be adopted and isn't one that actually would disrupt the current encounter-based approach to healthcare. So I think you have the right idea, and I'm in this sector to try to help people do that. And I think there's people here who are actually tackling that problem. I mean, if we used half of the stuff we saw today, it would be a more fun health system for sure, for doctors and for patients. So I think there's a lot there.
How many doctors are in the audience, by the way, out of curiosity? 2, 3. That's right.
All right, we can open up a practice.
So there's a question from Twitter, which I should ask. I'm going to put it to you, Steve. Women drive most healthcare decisions, so how can we encourage more women to pitch more to VCs, to start up more companies?
That's a great question, and it's actually the same thing that men need, which is just help in shaping the discussion about what the VCs care about. Jokingly about the Bob Kocher filter, but there are, I actually should have had the data on exactly out of the 120 applications that came in, how many were women, but there were well over a dozen women, I think probably closer to 20 women at least that I can recall out of that are trying to develop a business or have developed a business and are working on pretty amazing startups. And so to me, much like our mission is to inspire and educate and provide resources to entrepreneurs, it's men and women are at the table to change healthcare as much as men are. I'm not seeing this divide. People are talking about it, and I know that we saw several women entrepreneurs today, which I think is pretty representative of what's now happening, which is women are starting companies and are. I don't think there's any shortage of of VCs who would be more excited to hear from women entrepreneurs and their businesses. And quite frankly, the men need more help than the women in terms of that, because sometimes the thoughtfulness that needs to be put into thinking through their business isn't thorough enough. And so I'm inspired by the number of women that are now entrepreneurs. And Esther Dyson and Linda Holliday, who were at the first roundtable, actually spent time talking about women entrepreneurs. And I think Linda was one of the most successful in the healthcare space. Said that, you think it's hard now. Think about 1992 when she started, or 1991 when she started her company. So entrepreneurship's alive and well, men and women. It's about health and wellness. I don't distinguish between the two.
Are women a market opportunity as well? I mean, do you see companies pitching kind of directly along gender lines, or using that as a filter?
I've seen some companies actually that are going after the fact that women make all decisions actually in households when it comes to consumption, and healthcare is perhaps one of the most important, but absolutely who are thinking through how to target correctly to women, and I think it's a good insight that you need to actually have women tell the men what to do, because if that doesn't happen, we're not going to get a lot of change in behavior.
I want to come back over here, but let me just...
I hope I didn't upset the women in the audience.
He's going to find somebody.
So I'm an investor. I've been actually started several medical device companies, and have been investing probably for the last 7 years. And so it's interesting just to be standing on watching the healthcare IT space. And I guess I would like to add my own rule, which is looking at the space, I always think about 4 Ps, which are, is it better for the patient? Is it better for the physician? Is it better for the provider, i.e. the hospital? And is it better for the payer? And I think that's one of the big issues in this market is those are all very important stakeholders. And I guess I'd like to hear your comments just as when we talk about disruptive and going around the system. I think one of the issues that we have with how long it takes to incubate these companies is when you take on one of those stakeholders and you don't directly benefit them, you have a ton of resistance. And so I'd just like to hear your thoughts.
Yeah, Casper, a good question. I think you're never wrong if you think about the 4 Ps and you have an answer that checks each of them. If you're not going to have each of them be aligned, I think you have to have one of them be massively motivated to work around it, and have a product or service or approach that doesn't require their full cooperation. There's a lot of things you can do in healthcare where if you got part of that ecosystem to be working together and getting a lot of value, you can create channels that will make you not necessarily have to have a hospital play or a payer play. But I think you're right. If it's not better for the patient, there's no prayer. And so above all else, I would say it better work for the patient. And if you have a lot of value there, you can probably square some of the others. But you can predict that any of those Ps that aren't aligned is going to actually push back and cause problems and delay you. And every successful company that I've seen in the last decade in healthcare has usually struggled with some portion of those Ps, saying I don't want this. And you better have enough value in the others to have the fortitude therefore to overcome them. Important point.
All right, let's go up front. Oh, actually, we'll go to the back and then we'll go up front.
Hi, Ishai from Agamatrix. We're in diabetes technology company. I want to ask for your observation about the moves that the FDA has been doing recently, specifically around regulating mobile medical apps. And in the session that the FDA held a couple of weeks ago, it was fascinating to see the FDA really engaging the industry and asking for comments and asking for feedback. And the only feedback that they got, or most of the attendants that were there, were Boston Scientific, Qualcomm, it was Verizon, AT&T, were companies of Fortune 100. And we didn't see a lot of the people that are sitting here in this room. Silicon Valley engaging the FDA back, and we are all relying on the FDA's regulation for our next company. So what is your observation about what the FDA is trying to do, and how can we do a better job engaging them back?
Sure. So I actually did some work on the mobile health regulation, at least conception, while I was still in the administration. And I think the FDA badly wants to not get in the way of innovation. And the questions that I was getting every day at the White House was, am I going to get regulated or not? Do I have to file to the FDA? Oh my God, if I do, I need $10 million more and I'm never going to get it. Give me some guidance. And so the FDA has gone through a tortuously painful and slow process to issue draft guidance, which is out now. The comments are due October 19th. If you Google mobile health FDA guidance, you can find them and you can submit your comments on them. You unfortunately have to read them before you submit your comments, and so prepare yourself. They're boring to read, but I'll summarize them in a couple sentences. The FDA has tried to be definitively clear that they don't want to regulate mobile health applications unless it's used for a medical diagnosis or a medical treatment, or it's related to something implanted inside of you. So virtually everything that we've seen today, save the eye test, is highly unlikely to meet any of those definitions. It's only when you're making a diagnosis or implanting something in you or telling a doctor what treatment to give that you're likely to have to go through a 510K process. And so the guidance, in essence, says that, and that should be comforting to most people. Now, you say, my God, I want to make the eye test, or I want to make an EKG on my wrist or something. The guidance, what you have to do is submit what's called a 510K. A 510K review to the device center at FDA is the least scary thing you could do, actually, when going before the FDA. You're shaking your head, but you should try the others.
I'm sorry, just a quick follow-up. The class 1 classification, MDDS, Medical Device Data System, is if you're a startup, you're moving medical device data from point A to point B. That's all you do. You need to put together, you put in place quality systems. Quality systems is something that most startups in the Valley are able or willing to put in place. So even at that level, you don't 510K is the next level for something more risky. Even at class 1, the FDA is going to ask us to put these systems in place, and that's not something most startups are willing to do.
Well, we can talk.
Are willing to do or don't know how to do?
Both. It also forces you to work waterfall, which is not something software startups are willing to do or should do.
So we can talk more at length, and you should all read the guidance, but the guidance is designed to say that virtually the vast majority of devices or medical applications that are being done do not need FDA approval or submission. If it's involved in the diagnosis and treatment of disease and meets the definition of a device, then it would, and then it would be subject to the device pathways. The device pathway is a much simpler approach, measured in months, not years, relative to the drug submission or biologic submissions pathways. The FDA actually has a small business office that exists to answer questions from small businesses, e.g. entrepreneurs, that at least while I was in the White House and I was looking into that office, was seldom called. Now, you might say, how do you find it? It's on the website, the phone number. There's a real human that answers in Rockville, Maryland, who will give you guidance. And they have, just like Startup Health has, a bunch of tools and guidances to help you get through. And they will talk to you before you apply to help you figure out what you might have to do. And so the FDA is trying hard to not be the the scapegoat for, oh my God, I try not to be the barrier and the rate limiting step here. And they have a bias in the mobile space towards not regulating. And they try to have that come through clearly in the guidance. And I think if those of you who are in the audience think that the guidance is not in that direction, you should comment vociferously. One other important thing that I took away from Washington is that the comments matter. So by law, they have to go through and say that they have dealt with the comments thoughtfully and mitigated the consequences that people put into the comments in order to enact a regulation. And in that process, they also have to demonstrate that the cost and benefits of the regulation bear out in the favor of benefit, not cost. And in the comments, if you say it will cost me $10 billion more to do this, they would have to actually prove that that's not true before they can put in a regulation. That's true in any regulation in government. There's this comment period, and this one's in that period. And so any comment submitted is actually taken more seriously than you would imagine. They are read, and they actually have to write through in the final rule how they dealt with the comments, and they actually account and put into the final rule the comments they get. And so I would encourage you, particularly if you're an entrepreneur in this area, to comment. And I suspect that they'll be very receptive to getting rid of needless barriers that would make it harder for you to get to market.
So two things I've been waiting to say as I've listened to the amazing wisdom that came out of you over the last few minutes, which is how lucky are we as a sector to have somebody like Bob Kocher decide to come in and not just come in as a venture capitalist, but come in to help us change healthcare. I mean, I think, I say this because I think it's indicative of what's needed.
I'm worried for what's going to happen next.
So I just came up with the second Bob Kocher tool.
Oh, no.
Which is going to be to help actually entrepreneurs make sense of all of this, so that, number one, entrepreneurs aren't afraid to.
I'm only a doctor, not a lawyer.
Right.
Like.
No, but the context of helping even think through some of these, so that entrepreneurs aren't discouraged from coming into the space and being innovative. Because I think that was when I saw the draft guidance, my first thing was, oh my God, it's just going to mean other people, they're going to go build other kinds of apps, because it's going to be like, who wants to deal with that? So we have to, and I know Startup Health aims to, in this structure, saying we have to make it so it's not intimidating to be an entrepreneur. And so we have the tools and the lawyers and the people working together so we can explain, if you're going to build an app that does that, this is what you need to do, but not make it a daunting, scary thing that doesn't bring the innovative things here. And so the wisdom that you bring in having shaped this, quite frankly, didn't exist in this space at this level before you got here in such a relevant, recent way that is so timely and is moving so quickly that I hope you'll continue to share some of this wisdom, but realize that the things that you bring up are the very things that keep amazing entrepreneurs from coming into the space. So I know Startup Health is committed to making sure that we get it into everyone's hands so they understand it.
I would just say to this audience, I'm not scared at all of the mobile device guidance or the 510K process, and I don't think you should be either. You might have to submit to the FDA for approval, but I have a high degree of confidence from having actually worked on the other side with them that they're sensible, and that you can get through it, and that the timing is not as long as you think, and it's not as hard as you would have sort of imagined. So, and then I'd finally say that most things that we've heard about today will not have to worry about the FDA.
Right.
Okay.
Let's go there.
Thank you, and thank you for doing this panel. We've all heard, and all the entrepreneurs that get into this realize how big the potential is. But I also heard comments, it's hard to sell to hospitals, it's hard to sell consumers, it's hard to sell to payers, it's hard, and the way these two things are going to have to come together, it seems, is that it does take more time on the customer sales acquisition. So my question is, do you think the VCs are ready to think about the realistic time it takes for a health IT company as opposed to a straight IT company to get a market share?
Well, I think the answer there lies in the fact that there's a ton of VCs that came today who made lots of investments in the past and are making investments in the future. And so I think there's a optimism among VCs that it's worth the time.
Shira had a question. Yeah.
Thank you. It's good to be here. I have a question specifically on the filter system and how that applies to Pivot. So my confusion is you go in and you pitch, right? And I have these nailed down, or I think I have them nailed down. And you sit there and you say, okay, she's got it nailed down. She's got a great market. We're going to give her money. But the odds are I'm probably going to pivot 4 or 5 times. So what's really kind of the essence of that then? Because I'm sitting here and thinking, okay, well, I think I have the answers to those, but when you're going to give me like 65 million or like Gaslight, but they've put it 6 times, I'm sitting there thinking, okay, well, how much do you really need to know that? Or is it more about the person, the team, she's still got to go out and figure it out, and we're going to place a bet on that regardless, she'll go and figure it out. Does that make sense?
Yeah, it's certainly both. I think you wouldn't have confidence in the person and the team if they haven't thought through these kind of questions at a fairly deep level.
Right.
Because by having that information as you're adapting your business model, you'll adapt it in ways that hopefully improves your value proposition to whomever ends up being the customer. It's also hard to pivot to something better if the first thing doesn't actually. You need to always have a good ROI on whatever you're doing, I think, to get started. Yeah, because it's hard to say, well, I'll figure out later how this thing makes value. You better have that in mind, and then you have to adjust it around the edges of who the customer is or how to price it or which channel to go through. The pivots are usually to add to the ROI, but not to find it in the first place.
Gotcha. Thank you.
Let's go right here, and then I think one more question back there.
So, the whole event today is sort of encouraging us to go slay some dragons out there to get rid of the crud and so forth. And I was just wondering, but what are you seeing in terms of startups or people doing really radical things that might be attacking, in a sense, the biggest dragon out there, which is the medical establishment itself, doctors themselves? There have been several very prominent books in the last few years, like Worried Sick and Overtreated and Overdiagnosed, which are quite damning about a lot of the common practices in medicine today. A lot of the things that are sort of touted to us as preventative or good procedures and so forth, according to these doctors, are really not proven and in fact are perhaps causing us more ill health than otherwise. And if that's true, then we should not be sort of trying to change just the processes of healthcare, but really attacking healthcare fundamentally. Just curious.
Well, to slay the dragon, you have to change the payment system. And so people that can come up with two things: a payment system that doesn't pay for activity, but rather pays for a different unit of care, are going to radically change the way the current dragon's working. And the second thing is systems that create markets that can actually buy and work based upon value. And today we don't have either. We have a payment system that pays for activity, and we don't have any transparency to allow there to be markets. And so fundamentally, the ideas that start tackling those areas are probably the ones that are going to be the most meaningful on accelerating the kind of the re-engineering of the health system.
Last question.
Great. Mine's about reimbursement, and I'm going to try to make the question fun. It's fairly, I think, accepted wisdom that startups shouldn't depend on CMS, CPT codes, go after that as a revenue stream, hence the focus on wellness and other verticals, right? And the ATA, for more than a decade or so, has made, to say politely, incremental progress on adding CPT codes. Really not much progress there. So Barbie mentioned something really interesting. So I work for a company called Telmedics. We actually do live medical grade video from any cell phone. So your dermatology case is a sweet spot for us. And we realized that because of the CPT codes, it's not going to be covered. We've got a deal going with Kaiser, and that's just great in the HMO space. And we had to pivot, though, to look at other verticals. The veterinarian space is an awesome space. It's cash and carry. People will pay an arbitrary large amount to make sure that Fido is well, right? And that was the fun part. So the reality is, we're going to be able to provide Fido and Bessie the cow with immediate health care where humans won't get it because CPT codes won't cover it, right? I mean, that's it, it's truth, right? So, but I wonder, there's still hope. There's hope springs eternal. What do you think? CPT codes and stuff, will it change? It's been so slow, and the ATA works hard, American Telemedicine Association. What do you think about that?
Yeah, I think the life of CPT codes is probably, I'll regret saying that. I think its days are numbered. Because as we shift to bundled payments and episode-based payments, which is required under health reform in 2015 for CMS, they're going to be paying for a long period of activity, whether it's pre- and post-hospital and hospital care together, or a year of asthma care. The bundle is going to be given, and the coding will not need to be, presumably will not be required at the level of CPT codes, which would enable providers to use telemedicine and all kinds of other things to rejigger the care. That's the premise of these things. And the private commercial insurance spaces are also going towards payment systems that will not require the kind of coding that's been requisite today in the current fee-for-service model. So I think we should all be fans of changing the payment system because that can unencumber us from the combination of ICD-10 and CPTs, which needlessly complicate the way in which we want to get productivity in the system. And maybe begin to make healthcare look a bit more like my dog's care when we go in, which is much more enjoyable for both us and the animal than a healthcare experience. And they know what it costs. You pay it at the front. It's reliable. They use clinical pathways and evidence. They have EMRs. So they can email you the things, and God knows it actually works well. So maybe we'll get there. But we will get there actually sooner than I think we've we think because the system itself is forcing us there for all the reasons I said before.
So I think it's appropriate that we started the day with, or we had during the day backflips and talk of rock bands, but we end with talks of regulatory codes, because that is the way of healthcare, right? You can try to sex it up, but it's always going to come back down to this stuff, which is why I think it's so awesome. Steve, you were thanking Bob, and I want to thank Bob as well, but I also want to thank you for starting Startup Health, because this is tough ground to navigate, and it needs networks. So thank you both. And thank you all for coming. I appreciate you guys sticking with us tonight.